special meeting of Jasper County Commissioners to order. We'll start out with the pledge and then a brief moment of silence. Pledge allegiance to the flag of the United States of America and to the republic which stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. All right, first up we have, looks like Chief Brandon Napier is here to talk to us about a fourth canine officer. Good morning, sir. Good.
Short. So essentially at the beginning of the
Hold on
year-
a second. Is your mic on?
Nope.
Hit the button.
You're good now.
Blue color. There you go.
All
good.
right,
Thanks.
sorry about that. At the beginning of the year, we did get confirmation from one of our canine handlers that in September, he's going to retire his dog. So we decided instead of waiting until at that moment to start a canine process, which could be a long process because we do have the guys raise the funds, so it's no burden on you to pay for the dog. So the guys do raise the funds. So we decided to go ahead and start a process now to replace the dog that's going to be retired in September. The timing's good. We have a local training, local-ish. It's going to be in Valparaiso rather than having to go up to Michigan or somewhere else to do the canine training. So we're just trying to take advantage of that opportunity. With that being said, we did decide that we wanted to add a fourth canine to our department. We currently have 3. This fourth canine is not going to, again, we raised the funds for the dog. We already have a new car that's coming in. The only adjustment we had to make to that new car was instead of having just a regular cage, we did the quarter cage so we could have canine in there as well. As far as any overtime or anything like that, we do feel like our budget is going to be able to support this fourth position. We just wanted to let you guys know that we are going to be adding on this fourth dog. It's something we'll be talking with the county council about as well, of course. So,
Okay.
Do you guys have any questions about the dog or the?
So when you're going to have 4 like these, do you rotate them as to when they get used, or have they all been used at one time on a particular case, or how does that work?
Yeah, sometimes. So especially like in the summer times when it's really hot out, you can burn a dog out pretty quick if they're doing a track. So we'll have one dog out tracking, and pretty much once that dog starts burning out, we can bring in another dog.
So you rotate them in. Okay.
Yes. So essentially what we're wanting to have is we'd like to get to a point where we have a canine on each shift, each patrol shift.
That was my question.
Okay.
Because if you're going to have one for each shift.
Yeah, so that's what we're working. So we do have the one dog that's kind of in the office, not in the office, but his schedule is a Monday through Friday type deal. So the other 3 dogs, working them into patrol is going to be very beneficial for us and for the citizens of the county.
And while you're here, just refresh me, and good to get it on record and for anyone watching on Zoom. How do you engage in your fundraising effort, for the dog? What do you guys do with that?
So typically what we have is the officers that get selected to be the canine unit. They are tasked, they put together like a fundraiser flyer for the funds that they need and what the funds are going to go towards. And they go around to local businesses and individuals that live in the county, and they seek out donations. They'll do things via social media or whatever means that they can to go out and seek these funds. So it's typically, again, it's not going to be a burden to the county.
And I would just say when the officer gets to that point and has that information, please come back to a meeting and let us know about it so we can also let the public know.
Oh, yeah, sure.
would
They're
be
already
great.
starting. We already
What's
selected.
the typical, just in general, what's it cost to get a canine dog?
So we're looking.
And that would be purchased and trained as well, right? I mean, the whole
Yes.
package. Okay.
Yeah. So the dog, typically when we get the dog, it's already trained.
Okay.
The canine and the handler, they will go to training together so they can learn to work together and how to become that team network. So we're typically looking at about 15,000 for everything combined.
Got it. Okay.
So, but now that we're doing 2, I think they're asking for 30,000 is what they're looking for now. So we have 2 deputies that we did select. We already went through that interview process with them. And they are already out there seeking funds right now, but I will get a letter for you guys,
Sure.
whatever that they're handing out, I'll get that to you. So you guys could post that as well.
Okay, that'd be great.
So you said you're retiring the third one in September.
Yes.
What is the time frame on getting the fourth?
Having the dog,
After the approval?
to do the purchase,
I mean, I didn't know if you just kind of had an idea lined up or not. If you're gonna
no,
look to replace the third.
we would like to have them purchased before September because that training takes place. Just happens to be in Valparaiso at the MAC Center. They have 2 positions available that we could go attend. So we'd like to have them purchased before September.
Very good.
All right.
How vigorous a training is that for the dog and the handler together? I mean, what is that, a 6-week training? Is that
It's 6 to 8 weeks, depending on which courses and stuff they go to. I do believe that the course in Valparaiso is going to be an 8-week course. So it's pretty vigorous. They train quite often. They're together a lot. They train at nighttime, during the daytime. Some of their days are 16-hour days that they do on training with the dog.
Okay.
So it's pretty intense.
Okay. We have any other questions for Chief Brandon?
No, sir.
All right.
Thank you, sir.
The only other thing I brought
Sure.
up here, just kind of brought in late this morning, we got it from Corey Myers, the EMS director. And I did give you gentlemen a copy of the email that we received from him. I placed one over here for Attorney Beaver as well. I guess we're just looking for an opinion from you on this email. If you want to review it, you can just get back to us when you can, I suppose. I know we're getting into it a little bit late. Sorry about that.
So do you guys have an opinion based on what the request is? So it's basically on refusal calls, that sheriff's officers could be used as a witness to witness the refusal?
Yes.
So is there a written policy that would prevent you from doing that, or what's the thought on that?
Well, currently, right now, Lexipol, who we have our policies through, they do not want us signing off on these refusals. I personally don't understand what the harm is for us to sign off. We're not. We're just essentially stating that we witnessed the care. We witnessed the EMS. We're not stating that they gave appropriate care. We're just saying that, hey, they were here. This guy refused. We witnessed him refuse it. We're signing off. We're not taking on the liability of saying that what the care was provided. We're not saying that they get good care, bad care. We're just essentially stating that we did witness the refusal. We did witness the interaction.
And so this is Lexipol is the company that's putting together standard operating procedures.
Yes.
That's updating your existing procedures.
Yes,
Okay. I'd have to take a look to see
So-
exactly what they're getting at, but
sure.
I don't see any harm in an officer recording their impression of events as it occurred because it's an incident report, more or less, even if it's not necessarily healthcare. So
Yeah, right. And typically our guys have body worn cameras on. They're going to see that they're just signing off, stating that, well, yeah, the medics were here. They tried to treat him. He refused care, and we witnessed that.
So is it possible, would you and sheriff consider that if Eric is able to determine either with or from Lexipol that it would, or is there a hold harmless contingent, component that could be developed so that you guys would feel comfortable to allow them to do that? Because Lexipol is just giving you advice. They're not telling you what you can or can't do, but what their suggestion is. So
Correct.
my question is, if Eric is able to determine that you would be free of any liability, would you guys consider allowing them to serve as that sign off, so to speak, on refusals?
Yes.
Okay.
Yes.
Okay.
And we are in we haven't parted ways yet. We are still under Lexipol policy at this time, but we are currently getting ready to part ways with Lexipol and go with the Indiana Sheriff's Association's policy 360.
So do you know if they have an opinion on something like this
That
yet?
was mine.
I should have let you go.
You're
You gotta
Keep it rolling.
Yeah.
You gotta tap my arm. I need to be
Yeah.
quiet.
Keep it
So-
going.
Go ahead.
Yeah, if you guys, do you know their opinion yet by chance?
I have not got to look at their
Okay.
opinion yet on that, but I'm sure that they do have an opinion
So,
on it.
and-
If
and
not,
when-
we will seek that
And
opinion.
when will you guys be making the change from Lexipol?
If everything keeps progressing the way it is, we should be launching with Lexipol mid-April.
Or Sheriff's Association
Yes.
mid-April?
Yeah,
So
sorry.
it sounds to me like you need to find out what the Sheriff's Association opinion is. Because since we're gonna be, Lexipol is gonna be discarded in a month or two anyway.
And I'll have that to you. Hopefully by the end of the day, I'll be able to get you an opinion from the ISA on that.
Appreciate it.
So Corey, is that okay with you? It may take a month or two, but we'll be able to get an answer and a good coordination here between you guys and Sheriff's Department. And I mean, while we're on the topic, and I know you're back there, we don't get any reimbursement for refusals, is that correct?
It depends on the type of, there's an evaluation of care being provided, yeah. And it will break down the level of care basically. If it's just simply we respond and they refuse any evaluation, any care, and we're just not getting the refusal.
Okay, all right. Okay, thank you. All right, good topic. All right, well,
Thanks.
Eric will help us get to the bottom of that and appreciate your consideration to do it if it's agreeable.
Sure.
Right.
All right. Thank you.
Thanks, Brandon. Appreciate it. Okay, Coroner Boersma was on next. He's out today, so we'll skip that one for the moment. Next up is talking about the extension office request and verbal approval we had given to Christal and Kelly to attend a grant writing class from Purdue. And which we are all in favor of that. The total was $450. And then we did ask them that once they get this skill set in place, how can we make sure that they're available for other needs within the county as a grant needs to be written. So anyway, did you guys have any comments you wanted to make on the topic? Okay. All right, so we have it before us. We should go ahead and do an approval here and then we'll sign this paper and hand it off to Cynthia. So for each of them was $450 for the grant writing class, which includes 15 hours of training covered over 2 days of class.
For both of them.
For both of them, yeah, it was $225 each. Would one of you want to move and make the motion to approve that request as presented?
Make a motion to approve.
All right, Ryan makes the motion.
Support.
Craig supports. Any further discussion? Not all in favor as presented, say aye.
Aye.
All right, that's approved. All right. All right, Director Corey Myers, time, you're up. Come on up.
Welcome to the gauntlet.
Yeah, well, Ryan said, welcome to the gauntlet under his breath, so.
Well, good morning.
Good morning. So give us, so we got one thing specific we're going to talk about, and then if you want to take a minute or two to just give us a brief update on how things are going, that'd be awesome.
Well, maybe a biased opinion, but I'm of the opinion that it's going really fairly well, actually. Employee satisfaction's high, equipment is being taken care of well. We're getting strong positive feedback from the community and our patients. Same feedback's being received from the facilities, specifically the Lafayette facilities, have taken note of the good patient care the crews are providing and making sure that that's being communicated up to us and Dr. Vukovic. So I think things are going extraordinarily well, actually. And we appreciate all your guys' support. New truck is set to be delivered tomorrow. If I get a time, I'll let you know so you can stop by and see it.
Yeah, pictures look nice and that's exciting. I know if you want to also, Corey had reached out. I don't remember if you guys were all included or not, but you had just a conversation with Wheatfield, talking with them, and he asked if it was okay that he does engage in conversations with other leadership time to time, and certainly agree that it would be. And that if any ideas or needs for decisions come up, then obviously bring that to us and so forth and so on. So
Sounds good.
out of conversations, are you noticing anything at the moment we need to be focused on?
No, nothing of immediate attention.
Okay.
I'm gonna reach back out and see if we can't meet and formally discuss any ideas that we may have between the two. Basically just fact finding and just initial conversations were had, and I didn't want to move much further beyond that without talking to you guys.
Right.
So
Yeah, and you're probably aware, we'll be approving here in just a little bit. Well, we already did approve, but we'll have an invoice. We're having a fire service study done for the county. Obviously, that runs closely with your service as
Right.
well. So be interesting to find out what our needs are and how we need to prepare to cover those daytime shifts when it's tough to get volunteers. So,
absolutely.
Are you meeting with EMS directors in those other two areas, or are you meeting with them and their trustees?
Well, I spoke to Ryan Myers.
Mhm.
I haven't communicated much recently with Keener. They had some administrative change. Just probably haven't gotten their ground yet to.
I would
to
encourage you
do so, but
to
yeah,
include the trustees if they
Oh,
want to
yeah.
come to, just
Yeah.
from that standpoint.
yeah, it's good to have communication. Obviously, you know that you communicate well with us. And the report you presented to us was pretty in-depth and amazing.
I'm a
That's,
stats guy,
yeah,
and I'll sit here and bore you to death on them if you want me to, but yeah, I'm a stats guy.
yeah. No, it's good to see things coming together and coalescing and how things are going. So today we have the invoice then for the new unit, $339,974.34. And and tonight, the council will make a move on this. We'll approve this and they'll move on it. And talking with council leadership, they have money in the lit EMS fund that we'll be able to appropriate out of to cover the cost of that. And then you'll just need to coordinate with Diana, the auditor, when you can get a check from after tonight's approval from the council. Am I assuming a council will be favorable tonight, Brian? Okay, thank you. We're laying it on you right now, so yeah, okay,
This has been a long time conversation. When did we start this? About a year ago?
March.
March?
yeah.
Yep.
So just
So you ready to start the new one?
easy.
I'll give it a month.
Yeah.
But you give it 11.
Okay. What's that?
Oh, boy, here we go.
I said 11.
Yeah. So any comments you want to make about the unit before we move on this?
Nope, we're excited to get it in service.
Okay. All right. So you've seen it. We've discussed it. We've talked about it. We're excited to receive it. Would one of you want to move and make the motion to approve this invoice to be presented to the council as given?
I'd move to approve the invoice to McQueen.
Okay.
Support.
Craig makes the motion. Ryan supports. Any further discussion? Not all in favor as presented, say aye.
Aye.
All right. That is approved.
Corey, what's plans with the retired ambulance?
So I'm going to present it to our board later this week, Friday, I believe. What I'm asking them for consideration to do is to donate it to KV High School. They've got multiple projects that they can utilize it for. It's not in any shape that I feel comfortable with another ambulance service purchasing it and using it for its intended purpose. I think donating it to KV, their shop students will be able to work on it mechanically and structurally, and they want to take the box off of the ambulance, dismantle it, put it into their EMT classroom upstairs and use it as a training aid.
Awesome.
So they'll
That's a
get
good
a
idea.
lot of
Awesome.
use out of all of it for years to come.
That's better than running it through the county auction.
I think our meeting's on the 19th. It's Thursday.
19th,
Thursday. Yeah. So
day by day.
I want you to be
day
there.
by day. It's in my phone.
Gotcha. All right. That's great. Good.
Yeah, good
Nice.
ideas.
Yeah, that's awesome. Excellent. All right. Well, I appreciate Dane and the guys who helped get us started. They were old, but they at least got the job done up until now. So
They laid the groundwork for us.
what's that?
There's a lot of peanut gallery
The-
talk coming on back
the-
there.
Yeah.
The ambulances were old, not the people. No, the people, not the people. The units were old.
Well, in post-COVID, they did the absolute best with the market.
Yeah.
That we got the absolute best that the time could provide, so.
Yep.
Couldn't get a new ambulance for 5 years at that time, so.
All right. Thanks, Corey. Appreciate it.
Very much.
Thanks, sir.
All right, next up, Health Department Administrator Kate Barrett. Is Kate here? Yeah, there she is. All right. I need to have you sit somewhere other than right behind the podium, now it's the podium, but the podium could be moved, I guess. Good morning. Good to see you.
Too, thank you. These are pretty simple. They're just our agreements that you've signed off on every year. It's just up for renewal. So in order to get the invoices paid, had to come here and,
Is that the Postal?
yeah,
I looked at it last night. So it was a 2-year agreement originally, and that was the first time the health department had a post machine. And this is a 3-year extension, going from 26 some odd dollars a month to $29 or so a month. So it locks in that rate for 3 years, and it includes maintenance. So at the outset, it was installation, but now it's just maintenance of the machine.
correct.
And I did review the portal, and the billing information, the address should be the auditor's office and not the health department.
Okay,
So the invoices would go that way. Shannon Kellner previously, and maybe still is the auditor's person who handles the postal agreements.
Is that how you still
Historical
have
accident,
Diana?
if
Okay. Well, if you haven't changed it, then that would, okay, all right.
Yeah.
So you're probably right. Okay.
But otherwise, I think that they have a new provider. So this is straight from the company, and it's no longer Kevin Sneeden was his name.
yeah, they just changed, same company, they just changed names.
Oh, okay. Because Pulse Technology is who they were
It's-
previously.
yeah, why, yeah.
Okay. All right. Any questions for Kate? All right. If not, then one of you gentlemen move and make the motion to approve the extension of this contract as presented.
I'll make a motion to approve.
And I think also the commissioners could approve Kate doing an online signature, because it's a portal with a quote.
Oh, okay.
DocuSign.
Okay.
Yeah, that sort of thing.
Mhm.
All right.
So the
So
commissioners could authorize her.
included in that motion would be to approve it and then to authorize Kate to sign it electronically. Who made them?
I'll make it.
Ryan made the
Yep.
motion. Okay. Craig supports. Any further discussion? If not, all in favor as presented, say aye.
Aye.
Okay. All right. We'll sign hard copies anyway, and then you can do what you need to.
Okay.
Anything else from Health Department?
That's it.
Okay.
Regan, I can report the Health Department Board has approved a request to increase certain user fees, and hasn't been done for a number of years. And it's my job to write the ordinance for the commissioner's consideration, and I'll get to that as soon as I can.
Okay. All right. Were you successful in the movement of the safes yet, or when does that happen?
Working on it.
We
Oh, you're
haven't
working.
put that in yet. We are still working on. it.
Okay. All right. I know we talked about it. Wasn't sure how far that got. Okay.
Yeah.
All right. Well, do you know what's timeline on that? Any idea?
I've just finally got the contact for another quote, so we have a choice. Kate was only able to find one person, so we're gonna
Okay.
reach out to him this week, and if he will do it, then I'll put him in touch with Kate and they can take it from there.
Okay. All right. Excellent. All righty. Thank you. Appreciate it. All right, Eric, you're up. You've got the Soil Water MOU and the EDP invoice.
I've both of those items I need additional time on.
Okay.
I have a template for the MOU for the soil and water, and I need more information as to the position as it's already presently defined and funded by the council, so I can write that up.
Okay.
I did discover that there is an annual MOU that has been signed for 2025 for another position that has not been come my way yet this year. And I don't
Okay.
know if that's still intended for the.
That would be, is that the weed board position?
This is the conservation specialist,
Okay.
and it had been approved over the course of many years. And last year was the first time I looked at the annual renewal, or annual approval. So I don't know if there's a change or whatnot. I'll look into it when I look at this.
Conservation specialist is Josh, right?
Mm-hmm.
Okay. So I would say that's the MOU that's been in place historically for many years.
Yes,
Correct.
Okay. All right. And then, then I think we had a second one being initiated for the weed board.
New
director.
position.
New position.
Yeah.
Okay.
It's a 1099 position
okay,
for the
okay,
county.
okay. So that it'll be a little different than what
Correct.
we've been using with the other one. The other one was the soil and water would contribute like $3,000 to what the council's appropriated. So this would be different, but
They have a whole breakdown of how they're going to fund it that they can provide you
okay,
and show you where it's coming from.
okay.
So you could talk with Jim Martin probably if you need to.
Yeah, he's the president.
Okay, well, and if it works out, I know we have a lot of other things on your plate, but if we can do that in the March meeting, then it's probably a good
Right.
idea.
Yeah.
Okay,
They're trying to get somebody hired as we speak
okay,
for that position.
Okay.
all right. Then the EDP invoice you were able to get together?
Well, I've got an email from Jake Damerol last week, I believe, and there's a lot more information in it than I expected. Asked a short question, got a long answer. I need to talk to Jake to ascertain exactly what we need for this particular construction compliance fund reimbursement request.
Oh, okay, that's for construction compliance. Yeah, we need that. We need to invoice EDP for that. That's right. Okay.
Yeah.
And then, and I kind of had you coordinating with Sarah and Diana for the second Dunn's Bridge 2 invoice. And I think, is that one going out or is it going out?
I believe Sarah,
Sarah did that. Okay.
she said she would pick it up. I haven't heard since
Got it.
on that one.
And then I think our first EDA payment from EDP will come in June. I don't know if we actually have to invoice it, but we probably should. do
Sarah
it.
said we didn't, but
Wouldn't hurt to probably just start a formal
Right.
process. So
absolutely.
we got a few months on that one, but
Mhm.
just that's one of the things as we go through discussing any kind of projects, want to make sure that our mechanism of collecting the money for the county would be
Mhm.
clear and repeatable.
Streamlined.
Yeah.
And-
streamlined.
And delineating where it came from and.
Yeah.
That
Yeah.
was on time.
All right, Eric, anything else for us this morning?
I do have Rick Hall's requested and that the commissioners approve an engagement letter.
Okay.
With Barnes and Thornburg. And it's their standard form. I can.
So you take that half, I'll take this half.
I printed out one for each of you.
Is there three? There you go.
Oh,
Look at that.
They keep
All right.
having.
Yeah, that's right.
Does this need to be done today or can this be done on the second?
If you would need more time to look at it, that's fine. Rick got it to me on Friday afternoon and I opened it up this morning. But it's their standard form agreement. And so there's nothing that would be unique with it. It's with regard to discussions, representation of the county for the data center developer and negotiations in that.
I'm gonna take a couple weeks to look at this. I'll have mine signed by, or looked at, and we'll discuss it in March.
Sure.
Yeah.
Thank you.
Sounds good.
Yep.
Cynthia, would you want to make sure that we have that on our March agenda? We'll get that.
Barnes Thornburg.
Yeah.
Yeah, absolutely.
Yep. Okay. Thank you, Eric.
Mhm.
Okay. All right, next up,
Thank you.
we had approved the contract last meeting with K2M for fire service study. We now have the first invoice. They gave us a schedule of what the draws are going to be. The total was 44,000. The first invoice is 11,000, which allows for project commencement, data collection, operational assessment, coverage analysis, develop delivery options. Actually, that's all the elements. So the first project commencement and data collection, is 11,000. And then the next phase will be operational assessment, coverage analysis. That'll be 11,000. Develop delivery service delivery options, another 11, and then the final reporting and presentations will be 6,000. So we're at the opening phase of this. So would one of you want to move and make the motion to approve this invoice for 11,000 for project commencement and data collection?
I'd move to approve.
Support.
Craig makes the motion to approve. Ryan supports. Any further discussion? Being none, all in favor as presented, say aye.
Aye.
Okay. It's approved. Okay. I reached out to Mike Cody, excuse me, Cody Construction from the Remington area to do a walkthrough and an assessment based on the layout and parameters that we needed to upgrade for the improvements inside the Remington EMS building. It's already being used in this capacity, and this would actually just segregate the living quarters more appropriately and separate air handling from the garage area, and be able to funnel that outside so you're not having those issues. It'll also add central air along with a furnace upgrade. It would also be able to put in a second shower, so you'll have be able to have male and female showers separated, and put in the kitchen appropriately with, you know, all plumbing and fixtures, et cetera. Total for that would be $75,380. And then the separate air handling part, which would be for the garage, would be about another 10 to 15,000. So it'd be around 90,380 total. The 10 to 15,000 would be from ZZ's. That's where Mike had reached out to get a quote from them. So
So I think it's fair to say on this, Reen, before anybody gets the misconception. So this building is a Jasper County building.
yes,
This building was donated from Remington EMS. What year, Mr. Historian?
it was I think it was 24. We were going through the process of it, 24, I believe. But it was the old town fire station, and then between Remington and Carpenter Township, they donated it.
Yes.
So that to the county, with then the stipulations that if we stop using it for this purpose, it could then revert back to their needs.
Yes. So this,
Since then, we did upgrade the roof,
Mhm.
and there was already some interior upgrades, I guess, or separations done. And this is just going to make the bedrooms better, the kitchen area better, and the living quarters in general.
we walked through that building September, October of last year.
No.
Yeah, it's definitely in dire need of being updated. That's for sure.
Structurally, it's a solid.
Yes.
Right. It just
Structurally,
needs.
it's a great exterior.
Yeah, interior.
You're not changing any structure.
No.
These are basically interior walls
Yep.
that, if they ever had to be removed, could be.
Yeah,
But,
absolutely.
and Mike said he'd be able to get it accomplished here in the next couple of months. So I do know our EMS personnel in the south has been kind of feeling like they're camping on the side of the street a little bit.
A little bit.
Yeah.
It is. So,
Less than desirable right now.
I know Mike, I've seen Mike's work. I know he does good work, and that would be a builder from that area. So that would be my preference, but unless you guys have something else you would prefer.
I'm fine with this. I think there's been a lot of time spent on this, and I know working with EMS and the commissioners spending time and you spending time down there to try to figure out what's the best layout for them to be a usable space. Being, you know, it's a 24/7 operation.
And
It's home.
the other thing too, there's going to be EMA storage.
That's right, for cots and. water,
Cots, there's
whatever, yeah.
garage space and actually a little office space there that Karen will be able to use for the storage of assets in the south end of the county.
Mm.
So
Perfect.
that its own separate entrance and so forth. So,
Mhm.
okay. I did talk with the town of Remington, and they're okay with the plan as well.
No building permits or anything like that.
No, he said basically everything it would be greenlit from their perspective. So
Where would we ask the council to pay for this from? Or was that yet to be decided?
well, that we had talked about possibility of the same lit fund from where the ambulance is coming, but I guess we'll let the council decide that, or we could use it our buildings and grounds money, unless we're feeling, I know we're gonna have some issues with the courthouse. We may not want to draw on that fund right now. Other third option would be EDA fund, but once again, I guess I don't have a particular preference. I think it's definitely a need, and I would certainly welcome the council's and I'll be willing to come to council meeting tonight and present this to them and let them weigh in on where they would like to fund it from.
Okay.
So I guess we could have an approval here and then pending council's decision on appropriation fund.
I'd move that we approve this quote from Mike Cody or Cody Construction and getting started on it.
Okay.
Support.
Craig makes the motion, Ryan supports, and then with that motion would be with council input as to the funding,
fund.
the fund line.
Yep.
Where it's gonna come from.
All right, been moved and seconded. Any further discussion? If not, all in favor as presented, say aye.
Aye.
That is approved. Next up, we have our probation director, Mr. Mike Spangler. How you doing today, sir?
Well, good. How's it?
You brought reinforcements.
I'm just gonna make a quick, this program, is, just so everyone knows, is supported by, the sheriff. He had to leave, Brendan did, but it's also our community corrections probation.
So,
We're looking-
so just to be clear, it's the peer recovery specialist?
Yeah, so they, Valley Oaks is, hired a peer recovery coach. And we're in the, I think they're in the process of wanting to do 3 or 4 possibly. This has become a big program throughout the state of Indiana. It assists individuals who, whether mental health, substance abuse, basically it's substance abuse, working with people that need help in life qualities and things like that. Valley Oaks has got their first hire. This young lady here, I'll let her be introduced by Autumn. Autumn knows what's going on. So they've asked us to help support them. They're looking to pick up just a little bit of opiate money to assist them with how they want to run their program and flyers, just odds and ends. So I'll let Autumn Smolenski's heading the program, or I should say, she's working with it. I'll let her introduce and then let her present the program to you.
Okay,
Then we're looking.
all right.
Next point.
Morning,
Good
welcome.
morning. Yeah, so I'm Autumn. This is Kathy. She's our first peer recovery specialist that we've got. So Valley Oaks covers a lot of counties. I'm sure you guys know. We are the second county to flight this program within our organization within Valley Oaks. Crawfordsville is the only other county that's flighting it right now through us, and they've had great success. And they have a ton of support from their community stakeholders as well. We're coming just to kind of like give you guys a rundown on what the program will look like, what our helicopter dreams are, and then to see if you guys would support us in helping us access some of the monies and funds. Because we're just navigating this, right? She comes with experience, lived experience, and background in the position itself. She coming to us from another company. So overall, a peer recovery specialist is somebody who just really meets the needs and the overall well-being of a person, whereas mental health, we're just treating mental health, right? When we have a peer recovery person, Kathy will explain it maybe a little bit more, and because this is her expertise, but she's going to bridge gaps as being an overall well-being person. We, as Valley Oaks, treat, the overall mental health of people, and she'll kind of tap into that with her own background, but she can provide more services, whether it's mobile crisis, which we're navigating, how we would use that. That's a big need here in the county. We're trying to navigate how to serve both the jail population and the corrections facility, which we already have that ball rolling and meetings set, and some of them have already commenced and concluded. Like,
So it's a less clinical option. I mean, a relationship, right? Is that my understanding? Okay.
so it is clinical, but it's very informal as well.
But it feels less.
Yeah.
Okay, all right.
You want to give a little bit of insight?
So people feel a little bit more connected with me because I kind of walked in their shoes. So they open up a little bit more and I'm able to kind of like bridge that gap and, help find resources and we keep them in treatment.
I mean, do they feel you're more accessible when a crisis hits or they're at a critical decision point, they're willing to reach out to you? Are you accessible that way, or how does that work?
Yeah, so logistically, that will be her role. She'll be more accessible to the community. Whereas like a lot of people are, so when we look at, the rates of people that come in and that will tell us they've relapsed or they've OD'd and they don't want to call, law enforcement and stuff because they're nervous of what's to come after that.
Yeah.
They have a person, hopefully like
Okay.
Kathy, to, reach out to say, hey, I'm struggling, I'm going to relapse or I have relapsed. I need either help. I need you to guide me. I need you to walk beside me. She's filling those shoes of just sit by me, listen to me, and help me navigate. That will be the most critical role for a lot of these people. And like she said, she has the lived experience where it's like, so prior to kind of trailblazing this program with her and going on maternity leave, I was actually, navigating and really liaisoning all of the IOP treatment that we have at our facility, the addictions program. And you know, I could connect with a lot of them based on my own upbringing, but I don't have lived experience of addiction, right? So I can't, so a lot of people interpret people that like, how are you going to tell me what to do? You've never lived this. She is the backbone of that. She's going to be able to explain, like, I know what you're going through. I've been there, I've done it, and I've overcome it. So that is her role.
Mike, isn't this kind of the outcropping of the discussions that we had like
Yes.
4 or 5 years ago? We were
Yes.
starting to, okay.
It is, and she's trained. She has to go through classes and training and take certified tests in the state of Indiana. Kathy does, so she has done that. We're in the process of, I know I have a probationer in the process of, she just completed the class, I think on Friday. She just contacted me. So we're hoping maybe that we'll have a second one. I don't know.
Okay.
We look. She will do she'll be going to their houses. So it's not like she just sits in an office. She'll be doing home visits. If they're in a crisis need at home, she's going to go to their home. So that'll be, you know, it's not just something she sits in the office and does. It's become very big with what.
So are we looking at obviously more than just a pilot program, looking to make this a permanent fixture?
Yes, we are.
And what would, so I mean, I've been reviewing through here. What's the bottom line? And what would your request be out of, and would this be out of restricted funds or?
Well, we're looking at, she's looking at opiate. We thought maybe through the opiate fund.
Well,
program.
so we have,
Restricted or non-restricted?
yeah, we have two, that fund
Okay.
is broken
Yeah.
into 2 lines.
I mean, I don't know what would be best. I don't know what we have in front. I don't have a clue. I mean,
Do you know what kind of commitment Crawfordsville or that county
So
has pledged?
I do know that through their county, they get $20,000 a year. And they also have JCAP out in Crawfordsville. So they get a lot of their funding from the jail itself to be able to push into the jails. We won't be able to, from my understanding, we can't house a JCAP. So we won't be able to tap into that money. So when we're going to the jails, we'll be utilizing all the money that we ask from you guys. And so we thought that $20,000 for the first year would hopefully get us and meet the need that we need. Especially we've met with Napier on a short-term meeting. We actually have a more formal meeting with Burkhart and Pat on
Okay.
Thursday,
Okay.
to see how we can push in services. So we're trying to model and mimic a program, right? Like their JCAP program is a 3-day-a-week program, 3 hours long. And the inmates and the officers in that service that will be the people that pick who can be a part of that program. Same thing out with corrections, if they feel like they're safe enough to meet with Kathy and things like that. We already have 5 people out at corrections that are going to start engaging with Kathy. So we've already kind of been rolling this ball. It's just, how can we meet the need with no dollars, essentially?
Yeah.
So, and we're doing the best we can, but some people, like in jail, you can't get insurance. So.
Right. Yeah. So, yeah, I mean, I can certainly see that would be a good use. I think what would be great if you could put together, I don't know, maybe a 2 or 3 year plan of what your funding requests might be. I mean, we do have a fair amount of money in there. I don't know if JRAC was going to want some money out of that, or is that what they were going to want was going to go towards this?
well, I think that would be, I'm not going to speak for JRAC,
Yeah.
but I think it does meet what we're looking for through JRAC.
Yeah.
We've talked about peer coaches in the past with
Right.
JRAC. So I think it does meet that need. I kind of talked to both judges very little.
Okay.
Because I just met them a couple weeks ago and got started on what we wanted to do. And they're running the program. I have nothing to do with the program. I'm just.
So what would be,
them and
so
trying to
what,
guide them. And
so what would be helpful for us, I think, would be, I mean, the amount of money you're asking for, I don't see as a problem, but to help us plan with you strategically, long-term, if you kind of let us know what your total budget is and what your request of Jasper County, how that fits into there. In other words, 20,000 your total budget,
So.
or I mean, it seems like you're going to stretch, you'd need more than that. But my question is, we can probably work with you, but it'd be great to see how the structure is, what your goals are, so that we have something to also work with the council on, because they have to be the one to do the final appropriation on it. But,
Well, this will supplement. She's
Okay.
an employee of Valley Oaks.
okay, so, all right.
So this is just a supplement to
Supplemental.
assist them with whatever
Okay.
needs they need when dealing with community corrections or with the jail or probation
Okay.
people. So is what this is. So it could be It might never more than 20. Next year might be 10. It's just,
Well-
we're gonna fill it out this first year to see
Okay,
where we're at.
that, I guess that's what I'm trying to get to.
and-
20 is a reasonable ask, but
Yeah.
it'd be nice to know,
Correct.
did that actually help get you what you needed to get what you needed done, or are you going to need more down the line? That's all. I was just trying to think how this, I think it's a great idea, a great plan. When we sat in those discussions years ago, I remember thinking just, it's going to take the right person to do the job, right? So, that has that experience and is able to connect
So,
with people.
to
So,
add to that, I know you guys wanted kind of a more outline of the money situation. Crawfordsville had $0 their first year, and so because of that, they could only take Medicaid clients.
Okay.
Right? There's only a certain population or people that were willing to pay out of pocket.
Okay.
That second year is when they requested the $20,000, and they've been moving forward. So they've been doing the program now for 4 years, and so starting their second year, they asked for that money. But they were behind the 8 ball. They couldn't serve a whole population, right?
right.
As of last year and this year, as of last year, they'd served 67 clients, both mixed pay, so it's Medicaid and commercial insurance, or out of their whole JCAP is a whole different thing because they serve 17 different inmates over 19 weeks across the calendar year that are picked. So those aren't in the total numbers that you'll see on that back page. Those are just the numbers that our C&E, was what we call it, Consultation and Education Fund, pay for. And then overall, last year, just with their county dollars that they've been able to, and then the Medicaid reimbursement that they get that we can use, they were able to serve, I want to say she said 42 clients as a whole. And they actually have 4, well, they had 4 peers, they're down to 3, but they're hiring a 4th now. So if $20,000 was feasible, that's why we asked for it initially for the first 2 years for them. They only had 2 peers up until last year. So that's kind of what we're going with. Like Mike said, the goal, the 5-year plan would be have 5 different peers. Right now we have 1. We expect this program to blow up, especially with the mobile crisis and crisis alleviation that we're trying to use to intervene. And so we have a second one that we're looking at for Jasper County as well already. So
Okay.
that's our plan.
So, okay, so reading through here, I think probably what we need, and if we can get you on the March agenda, if you can just give us a formal request for the amount you're wanting with a letterhead on it, something that, I mean, this is good fact finding. That way we have something to specifically move on. Does that make sense to you guys?
Yes.
Yep.
Okay, all right.
What's your coverage? I mean, so are you just covering Jasper County and Jasper County Jail, or are you covering Pulaski County, Newton County, other counties around from the Valley Oaks standpoint?
From Valley Oaks standpoint, so we service a large population.
Like 9 counties, I think, or it used to be.
It's not.
Valley Oaks covers a large population. Kathy will just be covering Jasper and Newton because that's our catchment area. That's not to say with those dollars, if absolutely necessary. And we'll take the same exact conversation to Newton County as well. But currently the population that we're focused on with these dollars is Jasper County
Got it.
Jail and Probation and all the things. So.
Well, when you go talk to the Newton County guys, tell them we expect them to match us at least, yeah. Okay, so I think what we need then would be, give us just a straight formal request letter.
Okay.
For what and maybe a paragraph or 2. Put your letterhead on if it's Valley Oaks or whoever the parent organization is, so we can move on that. And I think it's worthy efforts to support. So look forward to your success here in the county and appreciate what you guys are doing.
Would it be best then for us we've got on the agenda for the council tonight to hold off on that, wait till next month after we get the approval from you guys then? Would that be best?
That would probably be the best option, I would
Okay.
think, unless we wanted to decide what line it would come from.
Well, it would be from restricted, I would say, since it's
I would think so too.
active, actual, I mean, I'm comfortable with approving it. You could still give us a letter though, that we could actually
Right.
approve after the fact.
I can get that to you guys.
yeah.
Yeah, that'd be fine. So yeah, if you want to if you're on the council's agenda tonight, Councilman Moore, is he still back there? Yeah, he's well aware of what's coming from. So it's another piece of the puzzle of the solution of trying to help with addictions. And we have granted some other small grants to these other, projects and endeavors in the county. So I'm in
All
favor.
focused on
Yeah.
Yeah.
rehabilitation.
So
Yeah.
I'd be in favor of if you guys are willing to do it.
Mhm.
Absolutely.
Yep.
Well,
Want to make a motion?
yeah, one of you guys want to move and make the motion to approve?
I make a motion to approve the $20,000 coming from opioid restricted fund be given to Valley Oaks for a peer coach.
Peer recovery specialist.
Yeah.
Okay.
The first one.
Greg makes a motion,
Support.
supported by Ryan. Any further discussion?
Can we make a contingent on Newton County makes a match?
I'll
Don't
make
stress
that,
me
I'll
out.
make that phone call.
He's gonna-
Yeah.
He's got an in with Newton County Commissioners.
I
So
was going to see him tonight.
yeah, you can tell him what we did.
I will.
Dare him
I will.
to go ahead. Okay.
Yeah, one
All
of
right.
us.
So we got a motion and a second. All in favor as presented?
Aye.
Say aye.
Aye.
Okay. But yeah, still go ahead and give us a letter. That way we can sign off, put it in our records.
Yeah.
And we wish you the best and keep us, one thing I would say as it's appropriate, just get on our agenda every couple months or every 3 months. Just give us an update, report how things are going, because we want word of these types of programs to get out to people, that there is hope and there's options in our county. So,
We do quarterly fiscal updates with
Perfect.
all of our C&E
Yeah.
programs from our chief financial advisor, so we can send those over and we can get on to be in person as well, but that's
Everybody sees us spending money. It's nice to see what they're getting for
Yes.
it.
absolutely,
Yeah.
no,
Yeah.
yeah,
for sure. Yep.
thank you guys so much.
I will give you, just so you know too, they're going to primary care. We're working on Valley Oaks. They're remodeling the building. I didn't realize they'd started. As you know, I'm appointed by the commissioners for the board of directors for Valley Oaks. We're putting primary care out here in Valley Oaks, which is a good thing because a lot of people, you can't get them to a doctor or counseling. So we'll have a doctor out there. They'll treat the people out there as well. So they can get a doctor's appointment plus their mental health or substance abuse. So that's coming probably 90 days. We're looking at 90,
We're
maybe
happy.
to 180 days.
That's
I
great.
believe. So there will be a doctor out there part-time to start, I believe, we're still working on it. It's going to be like 3 days a week, but I know that's going to go to 5 days a week is what their plan is down the line. Just so you're aware. Also, we're in the process of, they're in the process of getting mobile care. So to assist police and ambulance during assistance for when there are calls, just so you're aware.
Yeah.
So they've got a meeting, next week with, is it next week? I think you said, I apologize, this week with their people. So that should be going well. So there are some things looking good.
Good.
So we'll keep you updated on that. But the primary care is I think a big thing. And then what probation has done, just so you're aware, we gone into with Holland Health. It's a company, we don't sign a contract or anything. We refer people to to Holland Health, and all they do is set up doctor's appointments, all medical, mental health, anything for the individual. Doesn't cost the individual a thing. It's a grant through the government. It's paid by Indianapolis. So we do that, and Valley Oaks is on our list because it's a local area. So they'll set up, all we do is just refer a name to them, and then they set appointments up, get everything set up for them. So that seems to be going well to assist people and getting things done too, and helping people. Now, transportation is a big thing, but we're working on that also.
That's great.
So,
Yeah.
Appreciate all the effort.
yeah, sure.
Yeah.
Thank
Thanks.
you.
Thank you,
Thanks
guys.
again.
Thanks,
Yeah,
Mike.
appreciate it. Good to meet you. Okay. Other business.
Yes. Some months ago, we did talk about, and I believe a letter has been sent, at least one, if not two, to the landowner of the old BP gas station down here at the 205
Yeah.
exit.
Yep.
Nothing's happened yet, and under my last time of checking in, there was no response from the property owner at that point. I guess I'm looking for us to come up with our next steps to.
Eric, is that it's an old gas station. We've talked about it with Mary. It needs to come down. People set fires in there, then Remington makes a frivolous response to it and wastes their resources and time. Is this the type of thing where we have to pay to get it torn down and then put a lien on the property, or how does that
Yeah,
work?
I think that this could end up on the property tax bill. Whatever the cost would be, it'd be probably a condemnation action. I think this is probably under the unsafe building law.
Right.
And
Yeah.
I'm not sure if that in Plan Commission orbit or not, or if it's commissioners directly. I'd have to see where that statute
Planning
is.
Commission has taken action on it, or it's not Planning Commission, but Mary's office has taken action on it, sending a letter, at least one, if not two. You may have some.
At minimum too.
Yeah.
Yeah.
But to my knowledge, no response.
Mhm.
I think the last I checked that the taxes were being paid on the property. But it is of everybody's belief that the fuel tanks are still there also.
And that could be an IDEM issue.
Right.
also.
Yeah.
So getting the structure down is one thing.
Mhm.
Proper removal of the fuel tank
Yeah.
is another.
Yeah.
And
Yeah.
that could end up with a IDEM remediation.
Yeah.
And so that's.
We wouldn't have to take care of that.
No,
I mean, that-
no,
That's
but
something that whoever buys the property is gonna.
Well,
have.
or if we end up with it because somebody quits paying taxes on it.
Oh, okay, all right.
Because of the extra fee we're putting on them for tearing the building down is where I'm going with it,
Correct.
then it becomes an issue.
Yeah, the city of Rensselaer maybe had a similar thing with the grandmas. They
Correct.
did a condemnation and tore it down. And I think that there were fuel tanks underground with that. I don't know where what the status is, but that's not a bad place to look to see.
Well, their
see how they've handled it.
redevelopment board is active and funded too. Ours is in place, but not funded or has been active for some time. And that's, I believe, how they did that out there.
Mhm.
So, just,
So two steps, we need to see if we have the authority and then we need to get quotes to get it torn out.
yep.
Or we have the authority, but we need to make sure it's properly dispensed.
I think, I mean, if you guys are all right with it, I'll get 3 or 4 people to look at it and see what it costs to get in a dumpster and get rid of it.
Yep.
And that way we have some number to talk to the council about when.
I
it comes to
noticed
that
it
point.
Saturday coming back from the girls' basketball game.
Okay.
It's like, man, that's gotta go, definitely. Yeah, sorry, let's do that. Thanks, Craig, for bringing that up.
Yep.
Okay, anything else? I know you had a drone recently flown up on the edge of the courthouse and we got some tuck point issues.
Yeah, there's been some identified. I'm having trouble downloading all the pictures that were sent to me by Officer Fontaine. So I'm going to try to get with him yet this week and maybe break down the file and split them up a little bit. And then I can share them with you guys.
Yeah.
But there was some tuck pointing issues. Maybe some drafts around a couple windows too.
Seal the windows up.
We only looked at really the north and a little bit of the east side of the building. Didn't go all the way around it. But to give us an idea before we had to bring somebody in there to get in a man lift and go up and be more intense to have something to show them.
Because you mentioned potentially the vendor could do that, fix the retaining wall as well.
Mhm.
And so we need to get this fixed before we would power wash the courthouse. We really
Correct.
don't want to be squirting water inside the place any more than already happens.
And potentially, if they're gonna have a lift there and going up and down, I noticed too that both of our flagpoles out there probably could take a coat of paint. Maybe we can get them to do that at the same time.
Okay. And then the other thing, of course, our lingering issue we need to get taken care of is the basement. We need to get it, any update on that so we can allow the departments to get their space reorganized and put back. Are we doing the outside bentonite clay thing or what? Are we?
Yeah, we are. In the last communication, they got really busy up in the mill and they didn't get to us in time when they wanted to. But they're gonna put us in the first thing in spring. It is weather oriented, so they can't do it when it's like frozen and that, but it's going to happen.
Okay.
Yes.
And then along with that, Craig, you mentioned we need quotes for the lawn, right? We need to get it.
Get it fixed. Yeah, from all our construction last year on it.
So Jack, just as a question, so we get that bentonite clay put in, what are we putting, what's the surface gonna be? Are we putting it back to stones, grass, concrete? What? Cause that's the space between the sidewalk and the building, right? That where they're gonna go down?
Mhm.
That's currently now just grass, I think, isn't it?
Yeah,
Do we want it, is it gonna stay that way or do you try to do something that will have less runoff or less water to even have a chance to get down there?
that'd be a commissioner's call, you know. I know we talked about concrete, if it sloped away or landscape sloped away would be better because some places it even slopes towards the building.
Yeah, I think
Yeah.
that was I remember who it was we had up there walking around with us on that, but I guess in my opinion, if we went up to the building and dug it all out, right, but went up to the building and then put a membrane down there and then sloped it away. So at the very least, when it gets to the sidewalk, is before it can go down, we lose any of that watershed that's just coming outside the building, right?
Yeah,
And then put it back to grass or
And then put
something?
it back to grass.
Okay.
If we put,
Well, you don't want stones there, I don't think.
no.
yeah,
that's not-
I've spent time pulling the grass out of the stone at
Yeah.
home. I don't think we want to do that there
Yeah.
too. So
Okay, all right. Okay. All right. Well, then there's more to those topics, but I guess Cynthia, to keep it as a reminder of us, please, let's have that as a perpetual agenda item going forward. Courthouse building
Yeah.
and
Ground.
lawn grounds. Yeah, exactly. Okay. All right. Craig, anything else? Right?
Yeah, a couple things for Eric, if he has a moment. What do we need to do about the magnet issue with the highway department and the accident that happened up north? They seem to be getting a lot of letters and phone calls, and how do we navigate that away from the highway department?
I need to look at it and give a certification that what they want is a certification that the documents that have been produced by the highway department are complete.
Okay.
And my opinion is that they can come look themselves and make that decision.
Okay. Ed, what is the frequency of those phone calls and letters going to the department? Once a week for sure, from what I'm understanding, maybe more.
Yeah, definitely once a week. Yeah.
Okay.
I've sent those documents over numerous times.
Yeah,
Okay.
it's on my list to do, but it's one that needs to get done. But it seems like there's always something that
No, I
needs to
understand.
be get done
Yep.
sooner.
And then just a reaffirmation of a conversation we had last week. Is there any way you can kind of get ourselves and the council updated on kind of the building spectrum and what that looks like out at NIPSCO and what their building plans, proposals?
I mean, as far as the building,
Permits,
as
yeah.
far as the building permit fee.
Yeah,
Okay.
and what
Yeah.
that looks like to everybody.
Yeah, I've done a lot of background research on that, and I'd like to get something out this week.
I would
Okay.
very much appreciate that. Thank you,
Mhm.
sir.
Thanks, Eric. Thank you, Ryan. Anything else?
That's all I got.
All right. Jack, anything?
Yes, we have a few road right-of-way permits that I'd like to do today. One, and they're pretty basic. The largest one, it's a MCC network where they've did many projects with the fiber optic in Jasper County. And this particular area would start at the Fair Oaks area, go to the east, and then run up our 1,000 west, which I think that's a good area where it needs to be done. Then we have another one here from NIPSCO, and we've talked about it's just a pole project. We do not really have permitting for pole projects, but we always let the surveyor know for regulated drains. It's down in the Remington area, but just for their safety's sake, or they want, we could sign a permit here that just says pole projects for NIPSCO. There's another one that we should sign off, and it's really the city of Rensselaer's. It's all in Rensselaer, 694 feet. There's maybe like 10 feet in our area, but we work so good with Rensselaer, and they've already had the company fill out all their Rensselaer forms. So just to be as a friendship, we would sign ours to let them know that the surveyor's office has had a copy of it so that they could research for any regulated drains in the area. And then we have a simple one for Comcast, just a simple bore under the road to go to the house in the wheat field area.
Okay.
Okay.
All right.
Jack, the first one you talked about, going up 1,000,
Mhm.
is that north of 14 or south? So they're going north.
No.
I just.
Out of our bridge area?
Yeah, I didn't want to get them interfered with their bridge project if they're putting something new in. Right?
Gotcha.
Good question. Okay, you've heard Engineer Jack Haberlin's recommendations concerning these permits for right-of-way use. Any questions? If not, we'll take, I guess we can just take them each individually. We need one of you to move and make the motion to approve these as presented. This was MCC Network Services LLC.
Make a motion to approve.
Support?
Ryan makes the motion, Craig supports. Any further discussion? Being none, all in favor as presented, say aye.
Aye.
Next is NIPSCO whole project. And is this the one going all the way across?
Should be a map.
Okay, it's a good point. Should be a mess.
Transmission, the big towers,
That's the one I'm going for.
a mile north.
Yeah.
Yeah, that's it.
On this topic, Craig, you said you were gonna maybe think we should talk to NIPSCO and see if they would have a public meeting with farmers,
Yeah,
landowners.
landowners. Yes, I had conversation with Karen yesterday
Okay,
about the landowner that had concerns. They reached back out to land agents to reach out to them. But in talking to the landowner, there's other people around there have the same concerns, and as we're getting to the planning season, I'm going to reach out to Karen again this
Okay.
afternoon and see if they'll organize a landowner meeting somewhere in Remington for those
Talking
folks
about
to
this-
give them the map
yeah,
so they
okay,
know where it's going to be.
all right. Thank you for doing that. We have information on this, so with that, need one of you to move and make the motion to approve this pole project for NIPSCO as presented. Even though we don't really have a lot of
Yeah.
permitting authority over it, but we still need to, we want to acknowledge it.
Make a motion to approve.
Support?
Ryan makes the motion, Craig supports. Any further discussion? Not all in favor as presented, say aye.
Aye.
That's approved. Next up is the one for the city of Rensselaer. UG directional board to install 2-inch duct with fiber optic cable. Need a motion and a second to approve this one.
Make a motion to approve?
Support.
Craig makes the motion, Ryan supports. Any further discussion? Not all in favor as presented, say aye.
Aye.
All right. Okay, and finally Comcast cable. As mentioned in at Jonathan Drive in Wheatfield.
Make a motion to approve?
Craig makes the motion,
Support.
Ryan supports. Any further discussion? Not all in favor as presented, say aye.
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 It's approved. Go. Sorry about that. Okay, Jack, anything else? Okay, I mean, we have things going, but nothing to talk about today. Eric, anything else from you, legal?
Nothing further.
Okay, Ed. Uh-oh.
Got a headache now.
To flip that thing back, huh? Which reminds me, we're gonna talk about, I guess maybe we'll talk about it in March, but we're getting quotes for a screen or a bigger TV on that we can put on wheels and a projector for people to use. So anyway,
Move the one by my head.
maybe move the one by your head.
Yeah, I did.
Oh, that's true. What you got, Ed?
So, hey, thank you guys for, I'm sure you saw the salt barn roof
Yeah.
got done
You
yesterday.
got her
So,
done.
Yeah, absolutely. That was huge. Thank you guys for that. Appreciate that greatly. So I got a couple more items to add to your list of repairs. I mean,
All right.
sounds like the day for it. So I got a couple estimates here for all of our overhead doors in the barn. We got one that doesn't work, needs repaired. We got others, some cables are getting frayed. So I got two estimates here for you guys to take a look over to get all the seals done underneath, get some cables repaired and get some actual openers repaired. So it'd be basically all of our overhead doors,
And that's in the shop part portion, right?
both buildings,
Okay.
out in the big barn.
Yeah.
Okay. And any more? I know I brought it up and you probably gave me an answer and I haven't thought about it. Anything more on that fence north about?
No, haven't talked to Ed recently about it.
Okay.
Have you gotten everything laid down out there where you want it to be or?
No, we got some work to do.
Okay.
Material
Yeah.
back there, but I mean. Yeah, I mean, we could get, a fence could be put in, we could get the material in
I mean,
later,
I guess
but I mean, we
not-
kind of know where it wants to go.
Not a high priority, but I
Not a huge priority.
kinda like-
I'd like to have it done by
I
when.
kind of like the fact that it would probably just look better as well. So,
Right.
Well,
Far-
soccer season, all that stuff come around.
yeah.
Yep.
All right, so we got two quotes here, which would be to, fix hinges, rollers, parts, cables. $30,471. That, I assume that's for the main shop? Or is that-
So that would be both buildings. We have our big building to the north. We have 3 overhead doors in there. One of them currently does not work. So that'd be our main garage shop and then the large building north of the salt barn.
Then the other one was from Steve's Overhead Door Company for $2,914.28.
I believe that's who did the EMS building in Remington,
I think you're right.
with Steve's.
Have you worked with either one before on anything?
I have not. I'm not familiar with either one.
I mean, I've heard of Steve's. I haven't heard of Portable. There's the Steve's one. Doors themselves are okay though, right?
Yeah, it's basically the cables,
Yeah,
some rollers.
Just the consumables that are.
Yep, some actual openers that aren't working right now. So I don't know if it's the actual opener itself or just the mechanism to open it.
Do you have a preference on these? I mean, I assume you met with these folks. Do you get any sort of opinion?
I do not. Corey and Nick met with them both, walked
Okay.
them through the whole thing. So if you've used one of them before and
I think Steve's would be,
Yeah, I mean, I'd make a motion to approve the Steve quote and,
we could take that out of courthouse buildings and grounds, I
Yeah.
would say though.
yeah, get them scheduled to come up and do it.
okay, thank you.
That,
That one is $2,914.28. Craig made the motion. Do we have a second?
that's support.
Supported by Ryan. Any further discussion? If not, all in favor as presented, say aye.
All right.
I,
All right.
Thank you. That's all I have.
Thanks, Ed.
Thank you.
Ed,
Yes.
on your trucks, I thought you said something about you weren't gonna look at purchasing any trucks this year. Tandems,
No, we are looking to purchase
are
one
you
tandem
aware
this year.
that, it's either August or September, a 7th tier comes into play on all the new models?
Okay.
So you might want to, I talked to a guy in the trucking business yesterday and he was pre-purchasing another 10 semis
Uh-huh.
to get them in the 6th tier before the 7th tier with more emissions on them to cause you more trouble. You might reach out to whoever your
Yeah,
vendor
we've
is.
been talking with Peterbilt right now, so we kind of got that in the works. So,
Has a Kenworth, but I would assume it's going to be across the board.
right.
Their timeline, you have to get those ordered before to get ahead of that or not?
I mean, if you could speak for the chassis,
December
you could,
Mhm.
well, I mean, if that goes into effect, yeah, well, that's true.
Right.
Guys out there are going to be sucking those chassis up, I just imagine.
Oh, yeah.
So
Yep.
just a thought. Yeah.
All right. Angie, any comment from clerk's office? Okay, all right. Thanks for coming. Appreciate it. All right, any other business, Brian?
You're held to 30 seconds. I said you're held to 30 seconds.
He said that. We didn't talk as long as you want, so.
I talked a lot.
And he's still talking.
Yeah.
No, I would just like to say thank you to you guys for supporting the ambulance and everything you do there. And the fire service study. I think there's a lot of important things going on in the county. And there's a lot going on in the county, obviously and most of them are important. But I just want to say thank you for your leadership on this stuff. And, I'm very passionate about the EMS particularly because, I've been on that board since its inception and I think we've built a very great service there, which we had a very big need for in this area. They all do a very good job. All
Yes.
3 services do a very good job and I'm very pleased with what we have. But I just want to thank you for your assistance along the way, on that, fire, police, everything. I mean, it's, we got a lot going on that most people in the county don't see the behind the scenes stuff that we have to deal with.
Yep.
So I just want to say thank you. Appreciate your support on everything.
You too, Brian. Thank you for your common sense input and sage wisdom. Appreciate it.
Thanks, Brian.
thank you, Brian.
All right, we would have a few minutes for any public comment. Any comment today? Okay. Anybody on Zoom care to make a comment this morning? Or any other business from anybody I missed? Okay. If not, then we would entertain the magic motion to adjourn. Our next meeting, I believe, is March 2nd. Is that
March
correct?
2nd.
Correct.
Okay, regular meeting. Okay. All right. I want to thank everyone. Diana, thank you. Anything from your office before we move past to the end of the meeting? Okay. All right. Okay. All right. Who'd like to make the motion to adjourn?
Make a motion to adjourn.
Motion made by Ryan,
Support?
supported by Craig. Any further discussion? Not all in favor as presented, say aye.
Aye.
All right. Thank you.